about a paramedic program preceptor. Um, Please excuse the white box in the upper left-hand corner. I couldn't get the PowerPoint to load on my computer without it. Who is a paramedic preceptor? A mentor is a role model, person who can encourage and motivate good communications both up and down with the lieutenant, battalion chief, as well as the paramedic student below them. Somebody who can foster a learning environment, shares knowledge with the student, and commits time to the student. Who is the paramedic student? They are the mentee, the committed member, a motivated person who can communicate, again, both up and down. They are receptive to critiques and communication. They are able to share their own knowledge and also commit time to their preceptor. Relationship expectations. We have a common goal for our students, and that is to become paramedics, get nationally licensed, working together. I don't feel that any student should be going that road alone, and so I think we work together as a team of not only one preceptor, but all students and preceptors together. Two-way communication. If the student has an issue or questions, they should be able to take that to the preceptor, and as well as the preceptor should be able to critique and question the things the paramedic student is doing. You shouldn't be receiving pushback either way. Mutual respect, I think that goes back to the communication. You respect each other enough to give yourself and your partner an opinion, but also listen to their answer and honestly take the feedback. Confidentiality. If there is issues amongst yourselves, I expect that it is contained on the ambulance and not something that's complained about to other students or other preceptors. Let's keep it professional, I think, on both sides. Communication. Never assume anything. Communication can happen in person, via email, texting, Skype or FaceTime, conference calls, or Google Docs. I know for myself, I really prefer an email or a text message because I am very likely to forget something if I do not write it down, and I am well aware of that. I keep a running notes tab in my phone. I also have text messages and emails that I save very frequently because I know that if I don't hold myself accountable and write it down, then I'm going to possibly forget. So please feel free to email, text, or call. Most likely, if we have a conversation in person or over the phone and I need you to send me something, I will ask you to send me a brief email with the topic or the thing that I need to be reminded of. It may be as simple as send paperwork, or it may be a lot longer of an email, but I will probably ask you to text me or email me what we talked about that day. Here's your contacts for class: Lieutenant Lesniak, his phone number and email, and then Firefighter Paramedic Webster, phone number and email. Chain of command. Our chain of command for the paramedic students is starts at the top with Deputy Chief Hedges, and then moves down to Lieutenant Lesniak, and then goes to Firefighter Paramedic Webster. Of course, if you bring me an issue and you don't feel that I resolve it, we can run it up the chain, or you can run it up the chain. Often enough, I feel like if you bring me an issue and I even have a question of whether I can handle it or not, I will usually run it by Lieutenant Lesniak, or at least brief him on what is going on and what I am doing. Because I know you guys don't want me to potentially make mistakes, and I also want to make sure I'm headed down the right path. So I am absolutely running things up the chain as well. Mr. Bloom, good old Mr. Bloom, Bloom's Taxonomy of Learning. This talks about 3 ways that people are able to learn: a psychomotor, affective, and cognitive, how they mix in the middle but also are separate on the outsides. Cognitive learning deals with memorization, critical thinking, and protocol application. Memorization as far as drugs and dosages, critical thinking and protocol application. A good example would be those two running together. You're able to use critical thinking and protocol application on a call that requires multiple protocols. So you're able to run between them while successfully treating a patient. The psychomotor, a hands-on assessment and starting IVs, as well as intubating, among other things that we do with the hands-on skills in the back of the ambulance. And then an effective learning is communication, attitude, and empathy for your patients. All things which you can work on, um, but you have to actively work on those things to upkeep the effects of them. Class schedule. Monday, Wednesday, Friday, 9 a.m. to 12:50. Saturdays is an online class. They offer online classes to keep the class title as blended, but as far as I'm concerned, these classes on Saturdays do still exist with online portions of the class. My Brady. What is My Brady? It contains pre-tests, homework assignments, optional post-tests and exams, and PowerPoints. They are the PowerPoints used in class. My Brady is the material that they are going to be studying on their iPad computer respective material. Platinum Planner. This is where they log clinicals, all clinicals, any topic. So if they're doing just standard ER, triage, OR, OB, whatever type of clinical is logged in their calendar there, and for the rest of the students to also log. And then they are also logging patient contacts. This is where they'll log the contacts they have in the back of the ambulance. Evaluations. Lieutenant Wessel, Instructor Wessel. I'm going to try and keep the titles separate because the jobs are not the exact same thing, even though it is the same person. Instructor Wessel has put together this as the program coordinator. It is a QR code for an evaluation that is expected to be done for every student by the preceptor prior to the end of shift. So if you are precepting a student, we expect that you fill out this QR code every shift that you work with them, regardless of how many calls and regardless of how much time they have, regardless of which point in the year they are. If they are a student, this QR code should be completed. I did take a look at it. It is pretty short. It may take a minute or two. It does not take very long. There's supposed to be copies hanging in each radio room. Daily expectations of a preceptor. Arrive ready to precept. That means arrive ready to be open to answering questions, fielding things that they're going to be throwing at you, as well as possibly covering the things that they're doing in class. Be a part of the rig check. You want to be able to double check their stuff and verify that they are looking for the same things that you are looking for. Teach them the type of stuff that you want on your ambulance and expect out of your daily rig checks. Be aware of where they are in class. Ask them, and hopefully they will be telling you. Meet the student where they are at. If it's test time or they're feeling overwhelmed, if they're extra stressed because of the things going on in class, maybe it's not the day to ride them about something that they're making mistakes on. Maybe take a couple of calls and write the reports for them so they're not completely overwhelmed with the work, knowing that when they get back, they, on top of having reports, will also be studying. I understand that we still type reports in the ambulance on the way back to the station. Sometimes maybe they just need that mental break riding back to the station while you type. Work on their style of learning. Be able to teach to them and on their level instead of the way that you learn. This is one of the biggest hurdles that I've had as a preceptor is how do I teach to somebody that isn't me? I'm well aware of how I like to learn and the best way that I intake things. But I think where I really turned a corner as a preceptor is trying hard to figure out where my student is at and how my student learns best and what I need to do to suit their needs most appropriately. Review calls as needed. Eventually the calls will become easier for the students. Reviewing may be frequent at the beginning and less frequent later on. Use your best judgment. Give them the feedback that they need and deserve, and make sure that they are making the appropriate changes and updates and getting better and improving that they need to be. Critique. Offer constructive critiques. They're meant to keep progress instead of stall them in their tracks. What I mean by this is Offer things that are going to be able to critiquingly push them forward rather than knock them down a peg or two. The goal is not to knock them down because they know something. The goal is to show them the thing that they don't know and work on the thing that they don't know and help to boost them up and move them forward. As a preceptor, be able to recognize if you aren't the best fit for your student, big picture or small picture. Small picture may be if they're going through cardiac and you know that the heart blocks, first degree, second degree, type 1 and 2, and third degree aren't your best topics. You know, you have a good handle on them, but you know somebody on shift has a better handle on them. Send them over to that person. Or big picture, if it's been 2 or 3 months and you really, really just aren't jiving with the student as the preceptor, it may be time to sit them down as well as your lieutenant and battalion chief and tell them, look, for their best learning environment, I think it would be better if we had a different student out here or they had a different preceptor. I'm not able to direct them the best to my ability. What is capstone? What changes during this period? It's the period over the summer, otherwise known as what used to be Mod 4. A student needs to be in the back of the ambulance to run a full call, final assessment period prior to being able to sit for the national exam. So they need to run, I believe it is 20 calls, start to finish completely, including report typing and phone calls. It's their show. This is the last time that you have to evaluate them. This is the period right prior to being able to sit for the national test. And I think as a preceptor, this is the most important time to be able to competently and confidently put together their evaluations and tell them really where they need to buckle down. I recall back to when I was a paramedic student in my Mod 4 evaluation, ELO was my preceptor, and the biggest feedback that I took away from that was that I was too hyper-focused on the fun skills in the back of the ambulance and had been neglecting running hands-on vitals. And that obviously it's still stuck with me because it's something I still remember, but it's something I hold true to myself, that I still try to take a blood pressure manually at least once a day when I'm on the ambulance. Not that I have to, not that I want to rely on technology, but that it shows the importance to me, even then, that my preceptor was able to see and show me an appropriate critique, and it stuck with me. So this is the time to really evaluate them heavily if they are making mistakes or they need to change their game or they have something that they need to do that is different, or even if they do something very well. That's the time to write that down, show them that. Be honest, tough conversations, end of shift evaluations. While this can be a point of uncomfort, you need to be able to present honestly how the things are going with the student. Both good and bad things need to be shared. If there is areas of improvement or issues with care, you need to address your student. If you don't feel comfortable, please come to either Lieutenant Lesniak or myself, and we will find a proper way to address. If there is consistent issues, please let me know. So it's highly important to give them feedback, both good and bad. Not only bad things need to be critiqued and evaluated. This is not a period or a time, these evaluations, that are meant to just break the student down and tell them everything they're doing wrong. You also need to advise and let them know, like, hey, you are on the right path for this. Keep going with that. Let them know where they need to improve. And if there is consistent times that you are just telling them the same thing seemingly over and over and over again, I please ask that you document that, because I have no way of proving how long this issue has lasted if you are not documenting that. And then bring that to me. As a preceptor, that is something that I can address with the student. That is something that I am more than willing to address with the student as well. And we can work on that together as a team, or I can sit them down and address it with them themselves. If there is consistent issues, please bring that forward. If you have any questions, please feel free to reach out to myself, Firefighter Paramedic Webster, or Lieutenant Lesniak. I'm more than willing to talk about this. Thank you very much. Have a good day.